My name is Loren and I'm a Senior Children's Development and Learning Practitioner based in Heighton Children's Centres. We work with families who get in touch with us who are having some difficulties around their children's sleep patterns. So they will contact the children's centres for some advice and support. With the sleep support programme, the age range is from 0 to 11 years. We tend to see a lot of the early years, so maybe 0 to 5s, but we do work with from 5 to 11-year-olds as well. They tend to come from referrals from Alder Hey Children's Hospital. Some of the issues can be around waking during the night, so they're actually falling asleep and waking a numerous number of times throughout the night. So it's a disturbed sleep pattern. Some of the issues could be children not going to sleep, so they could be going to bed at a reasonable time and then not being able to fall asleep till 1 o'clock in the morning. So then we'd look at a plan to put into place. Other issues might be children sleeping in their own beds, so they could be co-sleeping with the parents. So we would put a plan into place to get children into their own beds and into their own bedrooms. Other cases could be children whose sleep patterns affect with night terrors or nightmares. So we would look into supporting them around them issues. Families can self-refer, so they can phone the children's centre. We will take their details. As well as families self-referring in for the sleep pathway, we also receive referrals from other outside agencies. So we have referrals in from health visitors, schools, on-site nurseries. Once we've got the background information, parents are then given diaries to go away and complete over the course of a week. So it's a full daily diary of what they do from when they wake up to when they go to bed, including meals, sleeps in the daytime, all the routine, daily routine each day is taken into consideration for a week. Then that diary then comes back to the practitioner, and the practitioner will analyse that diary and put a support plan in place for the family. The practitioner will meet with the family to give the support plan that they've put together. The family can then go away and put the support plan into place, and the practitioner will then contact the family maybe a week or two time and find out how that support plan's going. If they might have some discussions on the phone with them regarding giving some more tips along the way that they've come along, or it could be that the plan's going perfectly fine and everything's working well. So winding down time is important for children before going to bed. So advising parents to switch off televisions, no televisions in bedrooms, because that just stimulates the minds and works overtime, and then that's why they can't get to sleep. Limiting iPads and computer games after a certain time. After tea time, it's usually good to have maybe like a bath time routine followed by a nice story time, then followed by bedtime. Sleep issues is such an issue for all families, and it's so common. We get families every day ringing up asking for help and support. Anyone who is experiencing any issues around sleep, just please contact the children's centres, because we're here to help and give our advice and support. A lot of our families that we see have good success rates, and the feedback that we get from families is really positive feedback in terms of us helping with their sleep routines and getting their children's sleep routines back on track.